You for joining me for another episode of Journey On. This is DJ Burr, and today I am speaking with retired clinical psychologist, Dr. Matt Jaremko. He goes by Dr. Matt. He is the author of an awesome book called Trauma Recovery Sessions with Dr. Matt, Narratives of Hope and Resilience for Victims with PTSD. Matt, welcome.
Well, thank you for having me, DJ. I've been looking forward to talking to you and the people that you reach.
Well, I'm glad that you're here. I think that you'll be able to give us an interesting perspective. You and I both work in the field of mental health. At least you did as a clinical psychologist and now retired. And we both have seen people come into our offices who need support and healing. And I'm curious to understand how you approach the healing process with survivors. And I want to know more about your book and how it came to be.
Okay, great. Let me start off by telling you that somewhere in my career, what I did, I had a job where I did brief psychological evaluations for people in a substance abuse treatment center, residential treatment center. It was for women. It was a unique one. It's called Nexus Recovery Center here in Dallas, the Dallas area. And the women who were in recovery in the treatment center could bring their families with them. So it was, women generally had their children, not their families, but their children. So these psychological evaluations I did were very brief. It was a clinical interview and a MMPI, things like that, which is a personality test for your viewers. But one question in the mental status exam that I asked these women over the course of 2 years of evaluating them was, has anyone ever been sexually inappropriate to you? And remember, these are all women who are in treatment because they have multiple times tried to overcome substance abuse. 85% of the people in that population, over 200 cases over 2 years, reported that they had been sexually abused. 85%.
It's heartbreaking.
It is heartbreaking. And the reason I bring it up is the second question was, did you ever get treatment for that? And less than 5% got treatment for it.
I believe it.
What they did was deal with their post-traumatic stress disorder by unhealthy avoidance measures like substance abuse. And that is what I've learned the most about treating people with trauma disorders secondary to abuse and neglect, and that they get stuck in avoidance patterns that are unhealthy, and because they feel like they can't do anything about it, they can't change the past, they remain stuck. And so we wrote this book, Beth and I, who's a survivor of incest herself, as a way to illustrate various ways that people can rewrite their story and step into the consulting room or the therapy room to begin to deal with what that trauma has done to their lives.
That's great. I'm also a childhood abuse survivor, and slipping into maladaptive coping strategies was a lot easier than facing the trauma. It really was, until I think I had no other option but to face the trauma because I was at the bottom.
Yes,
so
I
understand.
In the short run, it turns off the pain or reduces the pain, but taking the step toward healthy recovery actually in the beginning adds to more pain,
Right.
It's a hard journey.
Mm-hmm. Well, one of the things I think it would be helpful if you could elaborate on is like the idea of post-traumatic stress disorder And what does that mean to the layperson?
Sure. First of all, let me tell you, can your viewers see the slide that I have up here?
Yeah.
Okay. It's amazing to me that 80% of people have reported a trauma in their life. There was a study done by one of my colleagues at the Medical University of South Carolina back in 2014. And this survey, a really good survey of over 3,000 people, came up with this number that 80% of people reported having a trauma in their life. And that's a lot of people. That's a lot of people.
That's a lot of people.
40% eventually adjust after about a year or two. 40% get what we call post-traumatic growth, which I will talk about in a minute, but 20% develop PTSD. And I have always wanted to know what the difference between those who, quote, get over it and those who develop PTSD. And I have found that, and this is the summary of what we're going to talk about today, there's 5 ingredients for successful trauma recovery. You see them listed there. You got to find somebody who will lead you. You can't do this on your own. It's like doing brain surgery on your own self. You have to have somebody who's facile and experienced in this arduous journey. So that mentor can be another survivor in a 12-step program. It can be a therapist, usually is a therapist like you or I. But you also have to develop a group identity. The best group identities I found was a therapeutic group of people of like-minded desire to overcome and process the trauma. And in the book, we describe in a non-fictional format how that works and why that works, but we also illustrate it by a fictional presentation of 7 different people who are recovering from various kinds of traumatic events. And so it's like reading a novel in one sense, but also in between the novel, the fictional parts, you have the nonfiction presentation of what's the psychology behind this recovery. And I always thought, I first started working with Vietnam veterans on this, who came back from the war. By the way, I just watched an incredible film, Spike Lee's latest film about Vietnam. Did you see that film?
I have not seen it yet. It's on my list.
The Five Bloods.
Yeah.
It is an amazing film about the devastation that traumatic events like that does over the lifetime. But the reason that these men were at all able to get any kind of coping in life is they had the platoon, they had their group identity. And I found working with Vietnam veterans that if you wanted to help these men, and occasionally we'd have a woman, a medic, if you wanted to help them get over it, they needed to form a group, form their own platoon, the mission of which was going to be to face the horror more directly in a more healthy manner, not with drugs and alcohol, not with running away to the boonies, not with all the other assorted methods of avoidance that people with PTSD use.
That makes sense to me. They needed some safety.
And boy, do you get it.
Yeah.
In the platoon. That was the only place that people who have been traumatized really truly feel safe, because they feel like nobody else gets them. Mm-hmm. Your viewers who are traumatized can't really be confident in somebody giving them advice or even giving them compassion unless they feel like they know the person giving the compassion knows what they're really going through. And you do that when it's another survivor that you're interacting with.
Right.
Also, I think that you need to learn how to be authentic, share what's happening, many of these people who develop PTSD following traumatic events hide it. And I'll say more about that in a minute. I also learned that there's many anxiety symptoms in PTSD, but there's also this change in your value system. What you believe was important is shattered. Let's say the incest survivor has no trust anymore. We raise children in the first 8 to 10 years to teach them to trust us, and then wham, somebody abuses them like that, and that trust, the whole notion of trust, the value of trust is gone.
Destroyed.
It's hard to live life without trusting somebody. You know from your clinical work that people either they either trust not at all or they trust too much.
Right. Yeah. There's a little moderation.
That's right.
Yeah, I understand it.
So you really need to help people somehow deal with or reclaim the lost or changed value system and the meaninglessness of their lives. In fact, it's that focus of treatment that I think has done the most, you get the most bang for your buck as a therapist, that once people find a mission, find a meaning in life, it might be that the incest survivor becomes a therapist or becomes a volunteer at a treatment center for the same thing, or they get enthused about doing the opposite of the trauma. And then with that kind of motivation, they can do the hard work of the long journey of getting through to recovery. Also, finally, the fifth ingredient is people need to gain confidence in taking these steps. I can't tell you how many times people will say, I'm sure you've heard it, it doesn't matter what I do. I can't, nothing will work. They don't have what we call in psychology self-efficacy. They may be able to believe that they can do the action, but they don't believe that action is going to help. Or if they believe that action can help, they don't believe that they can do it. And the belief that you can take a meaningful step and that it will have an outcome is necessary for almost any activity of daily living. It's certainly necessary with the hard, arduous task of overcoming traumatic events.
I agree with that. I think one of the things that I see most often is people also don't believe that they deserve to have it. Right? They don't deserve to be healthy and happy. The shame continues to eat them alive.
Absolutely. And isn't that, that's the nature, we're all cognizant of bullying these days, given the political climate, but isn't that the nature of some of the perpetrators that do this? They bully and they destroy the self-image and identity of their victims with all the gaslighting and with all the redefinition. And it takes a large, powerful, not a large, but it takes a potent community group identity to reclaim that identity and that value system. More often than not, however, traumatized folks don't talk about it.
Yeah, I'm wondering, in the work that you've done, have you found that these necessary ingredients are helpful for individuals who are really young when the abuse happens, like let's say 2 or 3, and they have fragments of what happened to them, or they were informed later on in life about what happened to them?
The youngest that I've had was 5, 6 years old. I don't know about 2. I don't have an answer to that because I don't have that in my experience, but it's very interesting. You're saying that if something happens so early that it is buried or conceptualized in a nonverbal way, or maybe a bodily
Right.
form, then
Yeah.
you have reduced access to it because it's not described in verbal terms yet.
Exactly.
My original, my initial reaction to that is, okay, so let's build a story. Let's take this stuff and let's imagine scenarios in the story. Let's be screenplay writers for a minute, or for a session or 5 or something. And let's see what a little kid who was exposed to, a toddler was exposed to that at that age. How do you flesh out a life like that? What are the possibilities? And which ones
Yeah.
fit for you? In other words, we want to provide some words that might fit.
Yeah. That's what
Throw
I
some-
do with folks.
Okay.
Yeah.
I
I
think it's
do.
real important to make the narrative something that leads to strength and health.
Absolutely. Yeah. I'm seeing more and more men who were abused at a very young age, and some as young as 3 or 4. And it's just gut wrenching, because they know that something has happened to them. They feel it in their body. They have been provided with some information, maybe from family member or a sibling, but they don't have the words to describe what happened to them, and they suffer. And addiction, because my primary specialist is sex addiction. That's they return to sex. They were sexualized and abused at a very young age, and they access the thing that they have available to them, which is their bodies, right? And they continue and they abuse their bodies and not recognizing that that's what's occurring, right? And that continues over into their adult lives, and then they have difficulties being in relationship with other people. And what I typically say to them is like, well, the first thing we have to work on is learning how to be in a relationship with yourself.
Yeah. Value yourself,
Yeah.
or see yourself as a entity of value.
Yes.
It is tragic. You're talking about the traumatic programming. There's also going on at the same time for men this maleness programming, that you're not supposed to feel these feelings or certainly show them in the way they need to be shown.
Right.
And we train our boys to be brave and stoic
Tough.
and tough, and do little training and teaching them how to be smart and diverse in their ways of expressing things, how to be artistic in expressing the totality of what your little boyness is.
Right. And compassionate and empathetic to themselves and to others.
But see, what happens, I have found, is that if you get a group of like-minded people, like you're doing this, it sounds like, in your practice, those people come together and they authentically communicate in that group setting in ways that show the absolute incredible power of that authenticity. And that is regenerating in a manner that I don't think anything else can be regenerating. That's how we get our values, by interacting socially with each other, coming to value the things that people that we value. That's what happens in the group therapies that you do. I have a little list of the kind of traumas that people become victimized by. First one is childhood sexual abuse, because it's such a lifelong thing and people don't ever get over that. There's a guy up in
Nope.
There's a guy up in your neck of the woods who writes young adult novels. I'm sure you know Chris Crutcher.
Okay.
Chris Crutcher is, I think he's in Spokane. But he wrote a great, great novel called Chinese Handcuffs about a young woman who has to overcome childhood sexual abuse. And it's just I had all of my patients that had childhood sexual abuse read that book, because the kid the character in the novel has a lot of strength. By the way, anybody who survives is generally stronger than people who don't survive, because they've had to deal with so much.
I agree 100%.
So you access that strength, which Crutcher did in this novel, and you see the girl team up with a love interest, 16, 17-year-old love interest, and then together they fight the world that is not allowing them to grow because of the sexual abuse. The perpetrator is still in their lives somehow. So yeah, something that happens at childhood a trauma that happens in childhood is going to have implications for your entire life, for obviously a longer period of time, because it happened earlier in your life. But there's other things that happen. The combat veterans, one of the things that, I'm not going to do a spoiler alert for the Spike Lee film, but I believe that one of the best ways for people who are reluctant to talk about their trauma is to read books and watch films that portray that, because there are so many good ones. And we have a list after every chapter in our book in which we list 5 or 6 movies or films that can be watched. And it's painful to watch some of them, obviously, because they trigger. But when you can do something like that, when you can take that step in that direction of exposing yourself to the trauma, then you get a little burst of what we call self-efficacy or confidence. And then you can build on that.
Yeah, I'm a huge fan of cinema therapy.
Good.
I miss being in my office because we could watch shows. Now I can put things like up on share my screen, but it's a different experience now that we're working from home. But cinema therapy is life changing, to be able to watch a movie and kind of see a character move through the world in a similar way that you have had to endure, and see how they come through that. Right? It's storytelling, and it's been very powerful for folks I recommend it for.
That is great. The people in Washington State it's nice to have you there.
Thank you. All right. So
this was your question, your original question. I took a while to get around to it.
No,
so
it's all right.
There's obvious symptoms of PTSD that we know, like reliving the trauma or avoiding situations and being numb and feeling keyed up, and shame and despair and poor control of emotions and impulsive and destructive behavior. But the lingering symptoms of PTSD are what get you stuck, I think. And you see them listed there. The first one is the most pernicious, I think, because it keeps you stuck, because you believe that nothing can be done. If you are a survivor of incest or rape or sexual assault or any of the traumas we were listed, there's a good percentage, 20% of you, who don't believe you can do anything about that, and nothing could be farther from the truth. You can't see yourself if you're right here, victimized, and you can't see yourself as somebody who is free from that. And the in-between requires several steps, but you're only looking at this part, the recovered part. Well, look at the part that's right next to where you are and take that first step. I mean, It's cliche, of course, but the wisdom of a good therapist is to help you find the best step to take, the one that you can take.
Yeah.
And we'll take that. And then from there, we'll take the next step and so on and so forth. And that is best done in groups. I'm going to keep going back to the groups. It's nice to have an individual therapist, but the most healing comes from the messages you receive from other survivors.
I agree.
Also, a lingering symptom is the imbalance between avoiding the unpleasantry of the symptoms and approach to meaningful activities. People like this just survive day to day. They don't think about a life of meaning and purpose, and they're just completely weighted down by the unpleasant symptoms of trauma reactions and anxiety and physical complaints and shame and despair and hopelessness. So when you're stuck like that, it's like something's got to move you either back or forward. I remember one patient I had who told me that she was abused at a young age, and she was still going to Christmas gatherings with the perpetrator, the stepfather. And while there wasn't any physical sexual abuse, there was continued to be leering and statements about her body and so on and so forth. And I basically told the person, you're going to have to stop going to Christmas gatherings. I can't do that, then I'll lose my mother. And obviously it was a very difficult task for her to do. But then I said, what can you do? If you can't do that task, if you can't cop out of the Christmas gathering, can you write a note to your mother? Yeah, I could do that. Okay, let's try that. Well, she wrote the note. It was, I made her put it in less than 25 words. I wanted it short and sweet. And that led to a burst opening of the dam, and she didn't go to the Christmas celebration.
Beautiful.
Christmas celebration. Wow. For 30 years, it had been, their Christmas celebration was an abusive event for this person.
Yeah, that one step. Can really just open you up.
It wasn't going to the, refusing to go to the Christmas celebration. It was writing the note.
Right.
That's what I always would do with people. I would say, okay, you can't do that. I get that. You can't do this thing that we're suggesting, but let's step back 10 steps. Can you do the 10th step before that? Whatever that might be. And we kept looking until we could find something that could be done. Okay, I'll try that. And oftentimes it is literary in nature, an angry letter. One of the characters in the book who was abused by an uncle, Dr. Matt somehow convinced her to write an angry letter that nobody would ever see. Just her and Dr. Matt would see it. So she did. And her cousin sees it, as the story goes in the book. Because she left it, she quote, left it out on the kitchen table.
Yeah, those things aren't usually just left.
No, they aren't. There's a lot of wisdom in our non-conscious.
Oh, absolutely. Yes, for sure. I mean, so I spend most of my time not only teaching people about self-care, how to care for themselves, but also about boundary setting. And so sometimes that first step is the boundary, right? In that case of the client who was going to the Christmas celebration, a first step could have also been, if I come, I'm staying for 20 minutes and I'm leaving.
Nice.
Right?
Yeah. So we have to be, and that's what's good about having a mentor. The mentor will come up with creative ideas like that. The victim is stuck in cognitive myopia. But the therapist comes up with much more creative solutions.
Mm-hmm.
And you keep trying those until the person says, okay, I'm going to try that. I'm going to do that. I'm going to make an attempt at that.
Right.
And
Progress.
Any performance accomplishment increases self-efficacy and confidence.
Yeah. I always tell my folks, progress, not perfection. Right. And when you're boundary setting, allow yourself to be sloppy at it at first. Right. It's the first time really that you're setting boundaries in a dysfunctional system. Right. And then when you set boundaries with dysfunctional people, they will react. Right. But you can respond, which is a different way of being.
Yeah, that's the crux of that first getting unstuck. Just because we have a horrible person that gaslights you all the time doesn't mean you can't find a way out of that.
Exactly.
And I was speaking politically.
Well, good.
No, I apologize for that. No, I don't apologize.
No, sorry, not sorry.
I see a lot of similarity between overcoming abuse, like you and I are talking about, and what's happening to us in terms of our national picture.
Mm-hmm. And you mentioned a couple of times about gaslighting. You know, a lot of people don't understand what gaslighting is. Can you sum it up?
Okay, so let's give it a definition first, and then we'll illustrate it with examples. I'll give one, and you give an example. Okay. It is somebody telling you that the sky you're looking at is orange. It's not blue. It's somebody giving you information that is the exact opposite of what you know to be or are observing to be true.
Mm-hmm. Mm-hmm.
And in the case with that I just illustrated a minute ago about the Christmas celebration, the mother of the victim said, "But that's all over with. He's a changed person now. He stopped drinking. He doesn't do this anymore. He's now a nice guy. He's not going to rape you."
Mm.
And yet, every time she goes to the house for any visit, the rape is symbolic.
Yeah, it's there.
It's there.
Yeah, yeah. I think one of the early ways that people succumb to gaslighting is when, let's just look at a parent and child. When a child is crying, they're upset, they're feeling out of control in their body, and a parent says, "There's nothing wrong with you." That's not true.
That's right. Exactly.
There's clearly something going on with the child. And for a parent to say there's nothing wrong with you, or stop crying, or something like that, I just think that's like the earliest gaslighting that you can experience. And most parents, they're not doing it intentionally. They're just repeating what maybe their experience was, but it's gaslighting. It's abusive.
It surely is.
And I have 2 kids, and I try my damnedest to not tell them that what they're experiencing is not accurate, right? I try to comfort them and tell them that I'm here. I see that you're upset. I'm here. You're going to be okay, right? Instead of saying, "Stop crying. There's nothing wrong with you." Because that's what I heard.
Yeah, just one of the skills that we generally teach in group therapy situation is active listening.
Yes.
What better place to have that happen where 5 or 6 people are talking about their traumatic events, and somebody sees, let's say person A makes a statement about, I feel this way badly in this way, and person B says, well, get over it.
Mm-hmm.
You know, put your big boy pants on and blah, blah, blah. Well, and then the entire group, the rest of the group just jumps on that insensitive, uncompassionate person. I've seen it so many times, and everybody's learning in that context because
Yep.
it's face-to-face feedback. It's the kind of stuff that the little kid who can't say, yes, I do have a fever, or my chest hurts, who somehow has a rejoinder to the parent who said there's nothing wrong with you.
Yep. Yeah. Yeah. I remember an experience where, like, many years ago, I worked with someone who never took a day off work. And I was like, what's going on with that? Well, come to find out that their parents forced them to go to school when they were sick, you know? And so
I see.
it just carried on, right? You can't take the time to take care of yourself because you have obligations, right? Well, the obligation is to take care of yourself.
It is. It is. Yeah.
Yeah.
So gaslighting is basically the perpetrator's way of getting out of blame, getting absolution. And it's horrible. It's just one of the most frustrating, damaging aspects of any kind of abuse. Because
I
not only
agree.
is the abuse continued, but your agency, your ability to discriminate blue skies from orange skies is questioned.
Mm-hmm. Before we run out of time, I wanted to get your opinion on there's something that I recently learned in a support group that I attended for male survivors of sexual abuse. They talked about the difference between PTSD and PTSI, post-traumatic stress injury. And what I gathered from the talk about the injury versus the disorder is that there's stigma that comes along with the term disorder. But an injury is something that's done to, like, is something that happens and there's some healing from it. Whereas I think some people see disorder and they think that's long term, that something's wrong with them, that they're damaged. Do you have any opinion about that?
Yeah, I'm greatly in favor of that.
Okay.
I think that the idea that you're injured, I see this commercial, I think it's on the sporting events, of some guy who's looks like a homeless person struggling with himself in the middle of a street. And it ends up being an advertisement about moral injury. And a lot of times, military people will have moral injuries because they are forced to do things that they end up being ashamed of and feel guilty about. And this idea that we tell them that they're injured, that being involved in that event of a combat situation has injured them versus that they have a disorder is a necessary ingredient in helping them change the story. There's nothing wrong with you as a person. You have been in a context that has injured you. And what are the consequences of that injury? The main one is, in my opinion, it's always that values vacuum. That what you believed in has been shattered, and there's this vacuum in there, and you have to fill it with meaning and things that are important to you and the people that you interact with and care about.
Right. Right. And with those injuries, some people try to hide their injuries, their truth, right? And that causes even more pain and prolonged suffering.
Yes, there's a great movie that is recommended in our book. The main actor in which was Adam Sandler, you know, the comedian.
Yeah.
But he plays a guy with a serious PTSD and plays it really well. I mean, he couldn't even, this PTSD symptoms were so bad that he couldn't remember having been in this traumatic event. And so he comes in contact with an old college buddy. It's called Rain on Me, by the way.
Okay.
He comes in contact with an old college buddy who knew him before all of this and who's trying to get him to remember what his life was like. And it is such a powerful presentation of the fight within that happens with people who have gone inside and have literally shut off parts of their memory system because the trauma is so hard, so difficult to face directly. That movie is one of the better illustrations of all the 5 ingredients that I've talked about earlier, that especially the self-efficacy one and the power of social companionship, social interaction, the sense of community that heals. It's called Rain on Me. Adam Sandler and Don Cheadle.
Yeah, I haven't seen that. I don't even know if I even heard of it, but it's on my list now.
Oh, it'll
I'm
blow
gonna check
you
it
away.
out. So, Dr. Matt, go ahead.
Be careful recommending that one to your patients because it's got a lot of triggers.
Okay, yeah, I typically watch the things that I before I recommend them, so I'm gonna check it out. But Dr. Matt, before we run out of time, I would love for you to tell our audience, you know, where they can locate your book, what they can take away from the book.
Okay, so you see there on the PowerPoint, the main objective of this book is to give victims a vision of what treatment and recovery looks like so that they can overcome their reluctance to step into that arena.
Okay.
So by telling the stories of these 7 or 8 people that we fictionalize based upon my clinical experience, you get an idea of several ways to approach recovery. And among those 7 ways, the person who reads it will probably be able to find one that is compatible with his or her journey, the beginning of his or her journey. So you can get this at Amazon. I'm a much better psychologist than I'm a book marketer. So, and my publisher is not giving me any help on marketing the book, but
they never do.
They never do. You know, I want to say this will change your life.
Okay, this will change your life. I mean, that's a great plug, right? All right. So the book is called Trauma Recovery. It's on Amazon. So I highly recommend that you get a copy. And you know, if you haven't started your recovery journey, let this be a tool to add to your new toolbox and lead you on the way.
Yeah,
Any final thoughts?
Well, I just want to thank you for being there for the people that you are there for, because, as I said, one of the ingredients is having an informed mentor that can guide you in this long journey. You see on the slide here, overcoming trauma is like walking from Texas to Alaska barefooted.
Isn't that the truth?
So we need people like you to help with that journey.
Thank you.
To guide that journey.
Well, thank you for giving us a roadmap in your book of what the trauma recovery could look like for some. And I hope that my listeners are able to identify with your characters, and hopefully that will lead them to a new place of healing and serenity in their journey. And this is what it's all about. This is why the podcast is called Journey On, because it is a journey and we have to move forward. So, Dr. Matt, thank you so much for joining us. You're welcome
Thanks for
back
inviting me.
anytime. Hopefully, there's another book in the future and you can come back and tell us all about it.
Okay, I really appreciate the time.
Thank you.